Namaste. Warm greetings from Balaji Vidyapith, popularly referred to as SBV. I am delighted to meet you all once again through Channel 1. I thank you for all your continuous support for Channel 1 video series. Today, we are going to address a very interesting topic, transgender health. Transgender people come from every region of India and around the world, from every racial and ethnic background, and from every faith community. In India, total population of transgender is around 4.88 lakhs as per 2011 census. Transgender people may be our classmates, our co-workers, our neighbors, and our friends too. But unfortunately, due to the stigma attached to them, a lot of transgender people suffer in silence. So, it is vital on our part to understand them and their issues. Everyone, transgender or not, has a gender identity. Most people never think about what their gender identity is because it matches their sex at birth. Transgender people are people whose gender identity is different from the gender they were thought to be at birth. Trans is often used as shorthand for transgender. When we are born, a doctor usually says that we are male or female based on what our bodies look like. But for some, the gender identity, their innate knowledge of who they are, is different from what was initially expected when they were born. Most of these people describe themselves as transgender. Some transgender people identify as neither male nor female or as a combination of male and female. There are a variety of terms that people who aren't entirely male or entirely female use to describe their gender identity, like non-binary or genderqueer. A lot of people get confused between the terms transgenderism and homosexuality. While transgender refers to gender identity, homosexuality refers to sexual orientation. Gender identity and sexual orientation are two different, distinct things. Gender identity refers to your internal knowledge of your own gender. Sexual orientation has to do with whom you are attracted to. Intersex people have reproductive anatomy or genes that do not fit typical definitions of male or female, which is often discovered at birth. A transgender person is usually born with a body and genes that match a typical male or female, but they know their gender identity to be different. On April 15, 2014, the Supreme Court of India gave a historic judgment, now famously called Nalsa judgment, declaring transgender people to be the third gender in India, recognizing the right to equality and right to self-declaration of transgender person. However, on the ground level, transgender people face a lot of problems which still makes the equality of transgenders a distant dream. This marginalization often excludes transgender people from many of the support structures, including their own families, leaving them with little access to services many others take for granted, such as medical care, justice, and legal services and education. Marginalization and bias around gender identity and expression regularly prevent transgender people from accessing fundamental public services such as health care and housing, and contribute to significant health disparities. However, times are changing. Trans persons are getting victorious in their fight against discrimination. This is witnessed by them succeeding in areas like competitive examinations like UPSC and civil services. Though these are far and few, still they mark important milestones. As with everything, SBV is leading ahead of other universities in this change. As you will see in the upcoming sections, SBV is pioneering in a gender inclusive campus, medical and mental health care, sex reassignment surgeries, placement services for transgender people, and various other services.
Hello everybody, this is Dr. Bhanupriya Tamil Selvan, Assistant Professor, Dermatology Department, SBV University. We also exclusively run a special transgender clinic on every Thursday at Dermatology Department. The dermatological care of the transgender individuals aims at elaborating behavioral history, various patterns of transition, and also identification and management of various dermatological and sexually transmitted infection. This includes an elaborate history of various behavioral patterns, high risk practices, and also assessment of their knowledge on safe sexual practices and also sexual protective methods being used among them. After this, the patient is examined thoroughly for any dermatological or sexually transmitted infections. At SBVU, we also offer IPL services for permanent hair reduction among all transgender individuals. This service is provided free of cost and is being used by all the transgender women across the country. This helps in boosting the confidence of transgender women to enhance the facial features towards a more feminine form. Thank you.
Hello everybody, myself I am Dr. Audappan, Associate Professor of Psychiatry. I have been a part of gender care team of MGMCRA since 2014. Transgender individuals, being a gender minority community, face a lot of stress from the very early part of their life. The discrimination faced by them in the family and social spheres make them vulnerable to many mental health issues, the most common being depression and suicide. Suicides are a very common part of transgender individuals. Also, substance use is another problem which they face. When they are not permitted to identify with the gender of their choice, it induces a feeling of chronic anxiety and depression, which can be related to gender dysphoria. The mental health services are among their foremost unmet needs. But however, in reality, the utilization of mental health services by transgender population is very low. This is mainly because of the inherent fear of rejection and discrimination due to their previous negative experiences. Further, an additional barrier is an existence of stigma towards the mental health services in the community, which makes them hesitate to seek mental health assistance. The Department of Psychiatry has been part of the gender care team since its inception. At MGMCRA SBV, we provide mental health services for all transgenders whenever they approach us. We counsel and encourage them when they are trying to come out as transgender. We do preoperative counseling and psychological assessment for transgender individuals before gender reassignment surgery. Also, we help them out in the post-transition process also.
Hello everyone, I am Dr. Saravana Kumar, Professor of Surgery, Chief Surgeon Gender Affirmation Surgeries for trans women clients. Gender dysphoria can be treated by surgical modification of the individual's primary and secondary sexual characteristics. Genital surgery is often the last and the most delicate step in the process. The first gender reassignment surgery of SBV was performed as early as 2014. We specialize in genital reconstruction and breast augmentation. For the last 7 years, we have worked with around 200 transgender clients, specifically male to female with high satisfaction rates. Our surgical team follows the standards of care as recommended by the World Professional Association for Transgender Health. It is important that health professionals caring for patients with gender dysphoria feel comfortable about altering anatomically normal structures. Thus, our institute strives to achieve holistic health care for the transgender community, addressing their physical and psychological needs. Thank you.
Hello, I am Dr. Meghna Bagalkotka. I am a consultant plastic surgeon here at MGMCRI Pondicherry. I here specialize in a category of transgender surgeries called as trans men surgeries. Now, who are these trans men? Trans men are the category of people who are transformed men. That is, they are born biologically as females and then they get transformed into males. And there are mainly 3 categories of trans men surgeries. Just like trans women surgeries, there is male masculinization surgery, facial masculinization surgeries. There are 2 to 3 varieties of breast surgeries, and there are bottom surgeries. Here at MGMCRI, I have been doing the trans men surgeries since past 3 years. Up till now, I have done around 30 to 35 top surgeries, such as wall reconstruction surgeries, and we will be soon starting the metoidioplasty procedures by next month once the corona period is over.
Hi, I am Dr. Sheetal K, a social activity based in Pondicherry. I started my career at MGMCRI SBV and Executive Manager in 2014. I have been involved in initiating a clinical setup for LGBTQ community and in development of the facilities as a learning site to other medical college and many state social health and department. We have provided career opportunities to LGBT members for recruitment in various sectors of the MGMCRI SBV.
Mahatma Gandhi once said, the true measure of any society can be found in how it treats its most vulnerable members. Transgender people should be treated with the same dignity and respect as anyone else and be able to live and be respected according to their gender identity. Living without fear of discrimination and violence and being supported and affirmed in being who they are is critical for allowing transgender people to live healthy safe, and fulfilling lives. I wish you the best of health. Do remember to continue practicing physical distancing, wearing masks, and personal hygiene. Stay safe. God bless you. Jai Hind.